Welcome to Live Better Without Surgery. I'm Dr. Joe Albano, your guide to exploring the innovative world of regenerative orthopedics. Join me as we uncover non surgical solutions that give you hope to move better, feel better, and live better without surgery. Let's get started. So, today we're going to talk about whole body wellness. So, what does this look like? Essentially, people will come to me for whatever the problem is. Say it's knee arthritis, for example, but they need to lose 50 pounds. Well, their knee is going to do lots better with the regenerative treatments if they lose 50 pounds. And oh, wait, they're also over 50 years old and they could be optimized on hormones. And oh, wait, they're also weak because of these injuries or this problem. And if they get strong again prior to any injections or surgery for that matter, you're going to do better. That's called prehabilitation, prehab. So basically, we're going to be looking at, in addition to regenerative treatments, looking at bioidentical hormone replacement therapy, BHRT, muscle strengthening, and weight management are the three things. And I'll throw one more in there, just supplements as well. So let's start with bioidentical hormone replacement therapy. What is that? First, it's bioidentical, not synthetic. So, biologically identical hormones that are compounded and made, and then they're identical biologically to what's in your and my own bodies. So, there's a big difference. In medical school, I was taught about, let's pick on estrogen and progesterone. So, we were taught to give the synthetic estrogen and progesterone for women in menopause to help with postmenopausal symptoms. And they're synthetic, and there's a lot of problems with these hormones for the health of the woman. So they're not great. And that's why a lot of doctors will say, yeah, you can do that, but just only for a certain amount of time and then get off of them. Well, it's not true for the bioidentical ones. So they're biologically identical to what's been in our bodies the whole time. We won't get into all the details and nuances of this today, but the philosophy is first, you're trying to optimize these hormones. And when we're 40, the levels start to decrease of all hormones in our body. And if you bring them up to a 30-year-old man or woman level, then that's really good for lots of reasons. So, for those of you who are watching this, you can see if you have a low hormone level and a high hormone level here, whatever the hormone is, doesn't matter. The principle is if it's below the low normal, every doctor in the world is going to give you a replacement and bring it up into the normal range. But I'm saying, even if it's in the normal range, if it's not on the high end, meaning ideal for a 30-year-old person of the same sex, then you could benefit from these hormones. And we bring it up because we're talking about helping your knee in that example, right? So you can improve the healing by bringing these hormones up to an optimal level. And so I liken it to fertilizing the soil with fertilizer before you plant the tomatoes. You can plant tomatoes without the fertilizer, but it's going to do way better if you put fertilizer in before. And it's really not a bad analogy. So, same thing. And then people will ask me too, okay, well, okay, what if I didn't get to do the hormones before we do the regenerative treatment? It's still worthwhile to do the bioidentical hormones later on, but ideally start it beforehand. So, bringing these hormones up to an optimal level is really good for the healing of tissues. And let's talk about some in particular. Testosterone is a main one for men and women. Woman doses and man doses, though. And women always bring this up. Am I going to have to start shaving? Well, not unless I give you a ton of this stuff. I mean, we could if you want, but most women don't want that. So we start at lower dose and then check labs as well. That's the other thing. So we start by asking about symptoms. Oh wait, your knee hurts and you're over 40, 50 years old. Yeah, you could benefit from this. But let's check your labs and see where you're at right now so we can determine the proper dose to give you. And then we'll have to recheck it, and everybody does this a little bit differently, but we'll usually recheck in 6 to 8 weeks or so and see where your levels are and then adjust them accordingly. And you don't want to start off at a really high dose. Start off with some reasonable dose. And if you need to go higher, then you go higher. And once you get it at a stable level, then you recheck them again at least once a year and see where the levels are. And thyroid is another one. So we talked about testosterone. Thyroid can really help. And it's T3 is the main one. And many people who are on thyroid medication take T4, which is levothyroxine or Synthroid. But T3 just seems to have uh, a more pronounced effect on healing, but also for just the effects of the thyroid. For instance, when we're talking about knee arthritis, and I'm talking to somebody, usually this is a woman now, and they're 40, 50 years old, and they'll just tell me, oh, yeah, but I've had my thyroid check and my doc says it's okay, but I'm so tired all the time. Well, when we look at the labs, then their thyroid a lot of times is in the normal range. But if we optimize it, the fatigue goes away. It's almost like magic. And it doesn't happen all the time, of course, but it actually happens a lot of times. I'll give you an example. One patient I know of, she was on a particular brand. She was on, what was it? It was Armor Thyroid. And we're looking at changing it to NP thyroid because it was a little cheaper. And she's like, no, I don't want to change it because it's working really well. Don't mess with it. So once people start feeling better on these medications, really like it. Thyroid can also help with healing. So we want to optimize it for healing reasons. Then you get into estradiol, and even for guys, but we don't usually replace and supplement estradiol in guys, but you could. Um, but estradiol has been shown to help with healing of tissues. There's a bunch of studies with rotator cuffs looking at that. So higher estradiol level, you're going to do better with your rotator cuff repair surgically or using regenerative treatments. Vitamin D is another important one. That actually is a hormone, but vitamin D with vitamin K, most people need 5,000 to 10,000 IUs of vitamin D per day with vitamin K. And other supplements you can use: vitamin C, a couple grams a day. Melatonin, even if you don't have trouble sleeping, getting you into deeper phases of sleep with melatonin is really helpful. And then collagen peptides, about 20 grams twice a day would be really helpful for tissues as well. Let's go back to melatonin for a sec. I kind of skipped through that. Basically, with that one, you want as high a dose as you can possibly take. So take it right at night before you go to bed. And then it helps you to stay asleep. It doesn't help you get to sleep. And start with 5 milligrams as a common dose to start with. Sometimes that's too much for people though, but you start with 5 and then you can increase every week or so by 5 milligrams and see if you get fatigued in the morning and have a hard time waking up. If you do, well, then you're on too much, back off the dose a bit and then could get on the appropriate dose. So those are the supplements. Also, sleeping is hugely important, hence the melatonin. But if you're getting 5 hours of sleep a night, even with melatonin, that's not good enough. You need to get 7 to 8 hours of sleep a night to have proper healing and recovery. So, really try hard to do that. Eat a good anti inflammatory diet. So, not a lot of simple carbs and complex carbs. So, simple carbs, candy, cakes, pies, ice cream, etc. Complex carbs, pasta, rice, potatoes, things like that. So it doesn't mean never eat these things, but you should minimize the use of those because they're very inflammatory. And having a more anti-inflammatory diet is going to help the knee do better when we do these regenerative injections. And getting lots of fluids is another important thing. So just drinking through the day and making sure you get some electrolytes in there, not just fluid. I'll give you an example of that. I was heading towards I think it was a 70 something mile gravel race up in Wyoming, and we took all day to drive up there. And I know better, but I still did this. I just drank lots of water in the car on the way there. And stopping and have to go to the bathroom a lot and peeing at night. I'm like, oh, I'm really hydrated. When I did the race the next day, I was so dehydrated, I didn't even pee the whole race. And it was like, I think it took me 6 hours or something like that. So it was because I didn't have any electrolytes in there. So make sure you get some electrolytes, but not too much. Everybody's different, depends on how much you sweat and how salty your sweat is. But basically, you need some electrolytes in there. Okay, and then stress is another thing. Good luck controlling that, but if you're less stressed, you're gonna heal better. And that is the intro to bioidentical hormones and how we use those. And I didn't touch on all of them, but those are just some to give you an idea in regards to healing. But there's other reasons to do it. It's really good for your health, basically, depending on the ones you're using, but you can have a better quality of life, decrease heart attack, stroke, dementia, things like that, increase muscle mass, decrease body fat with various bioidentical hormones. So they're good just in the long term if you're over 40 or certainly over 50. Okay, moving on to let's do muscle strength next. With muscles, if you have knee arthritis, you're going to have weak muscles. Quads are going to be the main one there, but you can also be weak up in the hip, in your core, or your gluteal muscles, or all of the above. So you want to strengthen these as much as you can, whether you decide you're going to have surgery or if you're going to do any regenerative injections. It's going to help you. I know, wait, maybe you had an ACL tear in the past and you had the surgery and you've never quite gotten the quadriceps muscle and strength back, the VMO, vastus medialis obliquus. We see this all the time, especially living here in Utah. Tons of people tear their ACL skiing. It's just so common. But you just people will try to do all these exercises and do them and be diligent about them, but still you don't get the muscle mass back. So that was a problem we struggled with, and have really good patients for the most part that are very diligent about doing their exercises. They're not just saying that, they're really doing them, and it just is very hard to get the muscle mass back. So we started looking at other options. How are we going to help people do this? And we found this one machine called the Emsculpt NEO. And what it is it's high frequency electromagnetic energy and radio frequency in there. So the radio frequency heats up the tissue, and the high fem will. It's basically a big magnet. Think of it like that. And it causes the muscles to contract at a supraphysiologic threshold. So, say you can contract your muscles voluntarily up to 10, it'll make you go up to 15. And it's really kind of interesting. You put it on and you feel it, and your muscles are contracting to these different patterns, and you have no control over them. And some of them are more intense than others, and you can control the intensity. And what seems to work is you need to have at least 4 of these treatments, 6 is better, once a week, and they last 30 minutes. And it's been really helpful. We've been doing this now, oh boy, for over a year, and noticed that people can actually get their muscle mass back. We measure them before and afterwards, and we can see. I just saw the other day a patient who had an unbelievable return in muscle mass. So it can really work. We do that in conjunction with these regenerative treatments. And you can't start it right away because you're contracting your muscle more than 100%. And oh, wait, we just did something that's going to hurt. So you can't do it right away. You got to get some healing. So typically we'll start about 6 weeks after we do a treatment and then continue it afterwards. So that has been really helpful. It can also be used for aesthetics reasons. It is developed as an aesthetics machine. You can put it on the belly or if edges or obliques. legs, so quads, hamstrings, calves, triceps are areas that people can use this to decrease fat and increase muscle. But here's the other thing. We'll get to this a little bit more when we talk about the weight. But if you put it on the abdomen, it can actually decrease visceral fat. And that's really pretty impressive because the visceral fat is, well, let's define it first. What is visceral fat? So it's fat inside the belly, basically. I mean, if you look at somebody who has a big fat belly, it may or may not be from this right underneath the skin, the subcutaneous fat. Actually, a lot of times it's not. It's more visceral deep inside the abdomen. And that's the really bad stuff. When you have a lot of fat in there, you get all sorts of medical problems with that. So if you can decrease that in any way, you're going to be healthier. And this machine can actually do that. It decreases visceral fat. There's a bunch of studies that show that. So it can be really helpful for that. And that is a summary of strengthening. All right, let's talk now about weight management. So if somebody comes in, they're 50 pounds overweight with their knee arthritis. Ideally, what I want, start them on the hormones, start them on supplements, get them strengthening, and then have them lose weight before we'll do injections because their knee's going to do a lot better with 50 pounds less around their weight. For every pound that's up around the waist, that's 4 pounds of pressure down on the knee. So it's really helpful even if people can lose a little bit of weight. So what's the solution to that? We used to do this program called Ideal Protein, and it had foods and things like that. And we had coaches, and it did work. It was a lot of effort for people. The company's since gone out of business, or pretty much gone out of business, so it doesn't exist anymore. And they just made the system easier for people to lose weight, and it was successful. But now with the GLP-1 agonists, so that's semaglutide, Ozempic, tirzepatide, Mounjaro, and things like that. These have been total game changer, and I'm pretty suspicious of weight loss medications even before the fen-phen days, if you remember those. So fen-phen was a fad back in the day. Oh boy, that was like mid to late 90s, I think, or right after that. And people wound up having heart problems because of it. So bad side effects, lifelong. Not really a fan of jumping into these things without knowing more of the details. So I didn't start right away with these GLP-1 agonists. I wanted to see a little bit, looked at the research on this. And as with any medication, there are side effects. And it seems to be about 10% of the time people will get side effects. Usually they're GI side effects, nausea, vomiting, diarrhea, constipation, things like that. And seems to be less with the tirzepatide or Mounjaro compared to the semaglutide or Ozempic one. And it's very, very helpful. We found people have lost a ton of weight. Sometimes it's a little bit more quickly than others, but people lose weight and it's been very helpful. So we'll start people on the weight loss medication prior to doing the injections. And that's been a game changer for a lot of these people. And oh wait, there's even people who are really thin who are on it for diabetic reasons, because that's the other um, use of this. It will increase your insulin. It'll decrease gastric emptying so you feel fuller, and it works up in your brain saying, oh, I don't feel as hungry. So there are three main ways that works, and it's been really great for our patients. So if you're overweight and having a hard time losing weight, which is so true for a lot of people, especially as we get older. I hear this all the time. When I was 20, 30, 40, I could eat the same stuff I'm eating now and exercise the same, and I wouldn't gain any weight. And now I've gained 50 pounds doing this. Well, that's because our bodies change. And that's where the hormones come into play and also the weight loss. So that's the whole body approach that we use here at the Albano Clinic, because we don't want to just talk about your knee and the arthritis and stick needles in it and do the regenerative things. And that's good, don't get me wrong, but it works so much better if we can incorporate these other things. So the supplements, the bioidentical hormones, muscle strengthening, and the weight loss. All of these things make it so much better. All right. So thank you for listening to Live Better Without Surgery. I hope you found today's discussion enlightening and empowering. Keep in mind that non surgical alternatives can lead to a healthier, happier you. Until next time.